Hello, and thank you for joining us for the first in a series of Ask the Doctor virtual series. And you can ask the doctor anything that you want to know. Well, maybe not anything, but a whole lot. We're so glad that you joined us today, and we really appreciate having our host, Dr. Octavia Cannon, who's going to be hosting this entire series. This was not an easy task. Dr. Cannon is a highly sought after physician. She's a board certified physician. She graduated with honors from Johnson C. Smith University in Charlotte, North Carolina, where she was a Duke Endowment and UNCF Scholar. She's also the 2018-19 president of the American College of Osteopathic Obstetricians and Gynecologists, and the first African American to hold that office in its 84-year history. She's been featured in a 2017 Suncoast Emmy Award winning PBS documentary highlighting the history of women in osteopathic medicine. She is awesome and literally puts the care and caregiving in all that she does. So I am so honored. I'm absolutely thrilled to introduce to you and having hosting this Ask the Doc series, Dr. Octavia Cannon. Thank you for being with us. This is going to be exciting.
Thank you so much, Paula. I appreciate you and AARP of Michigan for having confidence in me today and for this series. I'm really excited about it. Good day to everyone out there. I am happy to be a part of this first program in our weekly 4-part series called Ask the Doc. Today, our conversation is going to be about dreams, reclaiming the night, or what we call sleep hygiene. A couple of housekeeping things before we get started. The first is, if you are unable to stay for the entire conversation, it will be recorded and you'll be able to see it on AARP of Michigan website on Facebook or on a YouTube page. So if you enjoyed today, tell your friends. They'll have a chance to see it again later. Or if you have to step out because it is the lunch hour and I appreciate you all, then you are able to go back and watch it a little bit later. If you have any questions during the program today, please share them in the comment section and we will answer those live. I have a wonderful person who's going to send the questions to me as they come in, and I'll address them if they have not already been addressed during the conversations that we're going to have with our two fantastic guest speakers today. Please know that we are not providing individual medical advice during this program. So if you have questions about your personal health, I want you to consult with your primary care physician. And if the conversation sparks questions, then I encourage you to make those appointments so that you can move forward and have the best sleep hygiene that you possibly can. That'll go the same way through all of the Tuesday afternoon meetings that we have about different subjects. And we'll go into what those are at the end of the program today. So let's talk a little bit about what sleep hygiene is. I think that's a term we use as medical professionals, but really it's a term that we use to describe healthy habits, behaviors, and environmental factors that can help you have a good night's sleep. It's certainly important, and it's critical to maintaining good health, especially brain health. As we get older and more seasoned, it is important to maintain that brain health so that you can continue to live your best life. AARP of Michigan is a leading source on information and resources to help support healthy brain function. So be sure to register for the AARP series on brain health, and that's taking place this fall. Just keep an eye out for it. If you are a member of AARP, you should be getting some emails and information about it. And if you're not a member, this is a great time to join. It's a nominal fee and completely worth it. And you don't have to be 50 or over. You can be any age and join AARP. Many times it's important for younger people to join so they can help care for their loved ones who are getting a little more seasoned. So please join us. All right, so let's get right into it. I want to introduce our first special guest, Dr. Robin Tucker. She's an associate professor of food science and human nutrition at Michigan State University, or MSU. Dr. Tucker studies the effects of sleep problems on diet-related disease risk and management. She led the development of the Sleep Education for Everyone program, and that's a free program offered by MSU to help people get more and better sleep. Dr. Tucker works with people to make behavior changes that can improve sleep outcomes. Welcome, Dr. Tucker. We're excited to see you today. Why don't you go ahead with your presentation?
All right, thanks very much. I think the slides will come up. I just have a few slides that I'd like to share with the group today. Very brief because we don't have a lot of time and I want to make sure we have time for questions at the end. So I'm just going to share with you some top tips to fall or stay asleep. So you're probably here today because you may be struggling with sleep issues, or you may have a loved one, someone you care about who's struggling with sleep issues. And honestly, you're not alone. Roughly 1 in 3 American adults don't get enough sleep on a nightly basis. And you can see from the map here, the states in the darker colors are the states where this is the most prevalent. So in Michigan, we have about 40% of adults who are not getting enough sleep each night. So like I said, you're in good company if you're struggling with sleep. Go ahead and advance the slide. So how much sleep should we be getting? Well, that depends on where you're at over the course of your lifespan. The younger you are, the more sleep you need. For adults and older adults, we recommend at least 7 hours of sleep each night. But this is fairly individualized, but really the recommendation for at least 7 hours stems from the fact that that amount of sleep is associated with less risk of a variety of conditions. And if we go to the next slide, I'll show you what those are. So you may be surprised, or maybe you're not surprised, but I was kind of stunned when I learned about the fact that not getting enough sleep, that getting poor quality sleep, those things are related to all 10 leading causes of death in the United States. So if you're having sleep issues, your risk for developing or experiencing these conditions is much higher than people who are sleeping well or sleeping enough. And these run the gamut from chronic disease like heart disease, Alzheimer's, diabetes, to infectious diseases like influenza, a leading cause of death among older adults, as well as COVID-19. People who were not sleeping well, had sleep issues, had a more serious COVID-19 experience and were more likely to die from COVID-19. Your immune system just isn't functioning at its top form when you're not sleeping well. And there are mental health aspects as well. So if you see in the kind of the top left corner there, intentional self-harm is you're at higher risk for engaging in those kinds of behaviors because your ability to regulate your mood, to make good decisions is impaired with sleep problems. Go ahead to the next slide. So I want to kind of explain this a little bit wonky looking figure to you because I think it's important that we understand how we fall asleep. And that may help you to understand some of the recommendations that we make regarding sleep hygiene behaviors. So when we're trying to fall asleep, what's happening is we have two systems in the body that should be working together to help us fall asleep when we want to. The first system is this kind of purple line here that you can see. And if we go across the bottom of the graph or the picture, you can see we start on the left-hand side with wake, and then we change into sleep, and then we're awake again. And that first system that's working to help you fall asleep is your homeostatic sleep drive system, which is a big fancy term for this concept of sleep debt. So the more sleep debt you accumulate over the course of the day, the more tired you feel, the easier it is for you to fall asleep. So if we look at the graph here in that purple line, you see it starts on the left. It's quite low because hopefully when you wake up, you've had enough sleep, you've had restful sleep, and you have low sleep debt. But over the course of the day, you can see that that's increasing and it kind of hits a peak, right? The other system that's helping you fall asleep is your circadian rhythm of alertness. And a lot of times we just kind of refer to it in shorthand as like, oh, your circadian rhythm, the circadian rhythm. And let's break that down just a little bit. So circadian just refers to anything that kind of has a daily pattern. It happens once every 24-ish hours. Okay, so that's circadian. And your body has many circadian rhythms. You have circadian rhythm of digestion, circadian rhythm of pain, and circadian rhythm of alertness. So in this case, when we wake up, and circadian rhythm is in that white stripe, as you see on the black background, the circadian rhythm, when you wake up for alertness, you're probably not jumping right out of bed ready to tackle the day, right? We need a little bit of time to kind of ease into our activities. Might need a cup of coffee, read the paper, whatever. But as you go throughout the day, you become more and more alert, and then you reach a peak level of alertness, and then that alertness starts to decline. When you have high sleep debt and low levels of alertness, you are very likely to fall asleep. It's going to be really hard not to fall asleep. Now, when we talk about things like napping, for example, if you take long naps during the middle of the afternoon, let's say, that's going to affect your sleep debt. It's going to reduce it, which means you won't achieve peak sleep debt until later in the evening, and perhaps too late for when you'd like to go to sleep. Your circadian rhythm, if that is not working for you, then you're going to have, you may feel tired, but your body just isn't ready to fall asleep. So we can kind of see that when you have jet lag. And with jet lag, you don't have to travel across the country or halfway across the world. You can experience social jet lag, which is really just when you're perhaps maybe your sleep behaviors on the weekend are radically different from your sleep behaviors during the week. And so it's almost like you're having that cross-country flight when you go from Friday to Saturday. Okay. If you've heard of melatonin, or maybe you take melatonin, melatonin works on the circadian rhythm system. What it's going to do is it's going to take that kind of gentle slope down, which we were desiring, right? It's going to try to steepen that slope and make it come faster. So you have that big difference between debt and alertness, and it's going to promote a quicker onset of sleep. So these are just some things to think about as we recommend various sleep hygiene practices. But I think it's kind of it's helpful to understand the physiology of sleep and why those things would be working for us. Okay, that's the sciencey part. So we'll go on to the next practical stuff. And I just have 2 tips that I'll share with you on the slides today, and then we can talk about more tips in the question and answer session. But the number 1 top tip that I can share with you today is consistency. Following a consistent bedtime and a consistent wake time to the very best of your ability is going to really make falling asleep at night easier for you. In fact, it's when we ask people who complete our Sleep Education for Everyone program, we ask them what the best tips and techniques are that we share. This is the one that comes over and over again as the top tip. What I recommend you do tonight and for 3 days in a row, you're going to give yourself at least 7 hours of sleep opportunity, because we don't want to shortchange ourselves. And every day you're going to go to bed at the same time and you're going to wake up at the same time, 3 days in a row. See what you think. See if you can tell a difference. The first day you won't notice anything. It's new. The second day you might not notice anything. But by the third day, that consistency starts to kick in. And what it's doing is it's helping to reset your circadian rhythm of alertness. We need to reset that every day so that it matches the 24-hour daily cycle. And that consistent bedtime and wake time do that for you. So that's why we recommend consistency. Next slide. Relaxation. So I don't know how many of you struggle with anxiety or repetitive negative thinking, also called rumination, when you try to go to sleep. But I am definitely somebody, this is my, sort of Achilles heel when it comes to sleep issues. So, you're great all day, your head hits the pillow, you start kind of spiraling in terms of thinking about maybe what you didn't accomplish today, what you have to do tomorrow. Maybe you had some conflict at work or with family or something like that. Something just kind of starts to eat away at you, and it makes it really, really difficult to fall asleep. Relaxation techniques, maybe engaging in deep breathing or meditation, these can actually promote more and better sleep. And there's science behind this, right? So we know that slow, deep breathing activates your parasympathetic nervous system. This is the side of the nervous system that's responsible for resting and digesting. In contrast, you have the sympathetic nervous system, which is fight or flight. So if we can activate the parasympathetic nervous system, we can reduce our heart rate, we can reduce our blood pressure, and we're just going to be in a better mindset for sleep. So I've got a couple of links here that you may or may not want to check out. There are guided meditations that can help you if you're new to meditation. You may appreciate some of the breathing techniques. For me, I will tell you, some of these breathing techniques make me feel like I'm about to pass out, like I'm holding my breath too long, or it's stressing me out. if that happens to you, then don't do those things, right? We have to try things and see what will work for us, because all of our sleep issues are highly individualized, but doesn't hurt to try, right? The next slide. 2 things that work for me, hands down, almost 100% of the time. Try these things. If you're not into meditation, if that seems weird, or deep breathing, there are a couple of other things you can try. The first thing that works for me is I'm lying in bed with my eyes closed, and I think about the number 1,000, and I start counting backwards by threes. So I'm lying there, 997, 994, and I just start and I keep going until I fall asleep. Why does this work? Well, it engages your brain in an activity that doesn't allow it to think about all of the things that are stressing you out or making you anxious. It's enough of a mental challenge that you have to think about the next step. And it's not interesting, exciting, or stimulating that's going to keep you up. I don't go to bed each night trying to break my record from the last night. I'm just trying to do this so that I quiet my brain down and it allows me to fall asleep. The other thing that I highly recommend is this technique called cognitive shuffling. The name isn't really important, but the practice is. So let me describe that. What you'll do as you lie in bed with your eyes closed is you'll think of a word, any word, doesn't matter. When I was putting the slide together, I thought of the word desk. The word desk starts with the letter D. So what I'm going to do is I'm going to think of as many words that start with the letter D that I possibly can. And with each word, I need to make a mental picture of that word. So the first word I came up with was dog. I'm lying there and I'm making an image of a dog in my head. Okay. And then I think of the next D word, door, mental image of a door. Doesn't matter what your door looks like. There's no right or wrong answers here. You just come up with a door and you move to the next word. When you run out of words that start with D, hopefully you're asleep, but if you run out of words that start with D, you move on to the next letter in your original word. We go back to desk. The next letter is E. I'm thinking of all the E words I can with the pictures, and I'm moving through that in a systematic way. I will tell you that I'm usually asleep before I finish a word, okay? But if you're not, you've probably given yourself, by doing this exercise, probably given yourself 10 or 15 minutes to try to fall asleep. And if you're not able to fall asleep, I would tell you to give yourself permission to get out of bed and go do something that is not stimulating, not exciting, preferably under dim light, because that's going to help with circadian rhythm of alertness. And just remove yourself from what could be a stressful situation. As you toss and turn, you look at the ceiling, you look at the clock, you're frustrated, you're just, you're not in a good frame of mind for relaxing and sleeping. Remove yourself. Go do something. When you start to feel sleepy, like maybe you could fall asleep, return to bed, engage in some of these activities, and try again. Okay. So I think that's really the last tip that I have time to share with you today. But I will put a plug in for our Sleep Education for Everyone program. You can find out more about that on that slide. It is free of charge. I'm not selling anything today. I don't make any money off of this. But you can learn more about that, or if you have questions, I'd be happy to answer those. So thanks for your time, and I look forward to our questions.
Wow, thanks so much, Dr. Tucker. That was great. I was taking notes as you were talking about everything. So many valuable suggestions. I think that it's important to realize, as well as the relaxation techniques you mentioned will also help with brain health. Just trying to count backwards by threes or by fours or whatever would help you.
That's a great point. Yeah.
Yeah, that is really great. I see things that I want to do for myself as well as suggest for my patients. So I hope that everyone that's listening out there can remember a couple of those tips and pass them on to people, because they are very, very valuable. Thank you so much. I'd like to move on to our second guest, Dr. Jennifer Edwards Johnson. She is an assistant professor in the Department of Family Medicine at Michigan State University, and she has served as the assistant clerkship director for the residency program there in family medicine. She's a faculty member with Sparrow MSU residency program, where she enjoys teaching and mentoring residents and developing curricula around the care of underserved populations. She earned her Doctor of Osteopathic Medicine degree at MSU, the College of Osteopathic Medicine, her master's in public health from the University of Michigan, and she completed her residency education at St. John Providence Hospital in Southfield, Michigan. Welcome, Dr. Edwards-Johnson, and thank you for taking time out to join us today, and we're glad that you're here. Why don't you give us your take on sleep hygiene and tell us what you would say to a patient who, say, comes to your office and has questions or concerns about it?
I think everything Dr. Tucker said is really excellent advice. One of the first things we start talking about when a patient comes in and is talking to me about maybe their trouble sleeping is we go through exactly some of the things Dr. Tucker suggested. We're talking about sleep hygiene. The first question I ask is, how much sleep are you getting, right? You know, it's an important question because sometimes we've heard different numbers out there and we think we need to be getting 10 hours of sleep. And maybe someone's coming in thinking, you know, I'm wearing my wearable and it says I should be getting this much deep sleep, but I feel good and I'm getting 8 hours, doc. Like, is that good? And so there's a little bit of reframing and there's a little bit of understanding how much sleep are you getting? Are you feeling rested? What are some of the things that you're doing before you go to sleep? Are you on your phone before you go to sleep? So I do a lot of sort of understanding the parameters that each person has around their sleep schedule, their sleep hygiene, and what they're doing before sleep.
One thing that both you just mentioned and Dr. Tucker mentioned too brings me to a question that I have about light, the bright light when you're trying to rest and having your cell phone. I've read that having your cell phone and even a television in your bedroom is not a good thing, that you should be using the bedroom for only sleep and sexual relations. And I had to throw that in because I'm a gynecologist, I'm all about love. So if that is the case,
I love that.
should we not have the TV on at bedtime? Because sometimes I use that to just kind of wind down. Or to be honest, sometimes I'm looking at my cell phone in the bed because I've been so busy all day, I haven't had time to check my emails. Then I started, researching to prepare for this conversation. I was like, ooh, I might be messing myself up. What are your thoughts, both of you? Dr. Edwards-Johnson, you first.
Okay, we're like double touching. I think we have a lot of good data that suggests the extent to which we can decrease that alertness before bed and we can really get ourselves in a relaxed state. That's really going to be a sort of sleep promoting behavior. So 100%, I agree with what you've read and most of what Dr. Tucker has already described. And, of keeping dim lights, right? Avoid bright activating lights or bright activating activities before bedtime, because those are things that are going to affect the alertness cycle. They're going to make us think we should be activated and they're going to be less likely to be promoting that sort of sense that it's time for us to, power down and go to bed.
What about you, Dr. Tucker?
So I'll just add that you'll see a lot of articles about devices getting a lot of bad press for causing our sleep issues. And I want to explain that even like room level lighting at night can suppress melatonin production. So if you remember back to my weird looking graph, our body naturally produces melatonin late when we're about to get to sleep as a signal that it's time to go to sleep. And so when you're receiving light from devices, from the TV, from even your bedside lamp, you're getting information, your body's getting information that it should slow down or reduce the amount of melatonin that it's producing. And we need that melatonin to help us fall asleep. So if you think that you're having trouble falling asleep, TV can help us wind down, but it could also be promoting problems for your sleep. So try it. For me, I'll tell you, I do go to relax and have the TV on right before bed, but I'm not watching a thriller. I'm not watching something that I have to watch the next episode of because it's so gripping. I'm watching reruns or anything that's just kind of helping me to relax and wind down. So it's kind of a personal preference or what works for you. Again, if you think maybe let's try this light thing and really reduce it, then see if it works. It may or may not, but you won't know until you try. Another thing too that I would recommend you can think about is if you are up at night, maybe you're going to the bathroom or something like that, and you need a night light. think about getting a red light night light instead of like the bright, or turning, when you turn the bathroom light on, you get flooded with all of that light. It can make it difficult to get back to sleep. But you can buy red light night lights on Amazon or Walmart, wherever. They're cheap, but that red wavelength is supposed to be better for you. It doesn't suppress melatonin production as much as white or blue light.
Wow, that's pretty,
I think
I've never heard of that. That's cool. Thank you for that. We have so many questions in the chat, docs. So let me get to the first one. The first question is from Sonia. At what point might you consider that your difficulty getting to sleep or excessive sleeping might be a symptom of mental health issues you need to address? Excellent question.
I think that's a phenomenal question. And it's part of why I think it's important that you are addressing your sleep needs with your primary care doc or the person who is helping you manage your care, because you can help screen for some of these things, right? We said that, average amount of sleep or appropriate amount of sleep for adults tends to be around 7 to 8 hours. We look at extremes of that, right? So if you're getting less than 5 hours or you're regularly sleeping more than 10 hours, we want to start to ask questions of why that's happening. We want to ask, are there other symptoms you're having? Are you not engaging in the behaviors that typically bring you joy? Are you having less of those experiences? We would screen for things like depression and anxiety. We would think about medications, alcohol use, for example. Alcohol uses, and I have these substances in the back of the hotel I'm staying in, and I say, they're bad for promoting sleep, because we think, I'll have a glass of wine before bed. It's going to help me relax. And what we know about alcohol, for example, is it's something that does help us relax. It stimulates receptors called GABA receptors, and those receptors are really sort of synonymous with inhibition and wanting to relax. The problem is that stuff gets metabolized really quickly. And overnight, we sort of get this phase where we get hyper aroused and we notice sort of breakups in that sleep pattern. And we tend to wake up and it breaks our normal sleep pattern up. So to get at the question, I would really get into some of what's going on in the rest of your life. What are the habits you have around sleep? And are there other things we might need to consider? Other medications, mental health concerns, etc.?
And I would add that if you are questioning whether there may be a mental health issue, then I think that's worth discussing with a healthcare provider, because I think that all of us are guilty of worrying about so many different other things, or sometimes addressing those things in other people that we ignore ourselves, hence the importance of self-care. We have a question from Rhonda. She says, I've been told as one ages, your body requires less sleep. Can you touch on this? And I think one of your slides, Dr. Tucker, kind of addressed that. So if you can touch on that again briefly.
Yeah, I just think it's important. I show that slide because, maybe you're watching this for yourself, but then you can also recognize that maybe you have grandchildren or children, and it's important to understand that we do need, just naturally through the aging process, we do require less sleep. I did a research study one time with preschool age children, asking them, their parents, how much they had slept the night before. And almost 100% said 8 hours. They got 8 hours of sleep, because that's what's drilled into us, right? Like that's the right answer. But if you look for preschool age children, they should not be getting 8 hours of sleep. I hope that the parents just didn't take the time to think how much sleep their child actually got and just gave me like the answer they thought was correct. So we tend to need less sleep over time. And again, these are our ranges. I will tell you, I really, if I'm on 7 hours of sleep consistently, I'm not at my best. I need more than that. And that's just how my physiology works. I'm also more of a night owl. Again, that's just my preferred time to work is in the evening rather than in the morning. We all have these individual differences. I would going back to the previous question, if you experience any sudden changes in your sleep habits that you think are attributed to mental health, I would definitely go to your physician and get that checked out, because it can be a sign, right? Anxiety tends to precede sleep issues. Sleep issues tend to precede depression. So if you're noticing changes, that's when I would go and get that checked out.
And be mindful of those things in your family members and loved ones. The other thing I wanted to mention too, we've got to get those kids and grandkids to put down those tablets at night and the cell phone, because it's affecting their sleep. And mind you, they'll be, they are crafty. They'll get away to do that while you think they're asleep under the blanket or whatever. But I would encourage you to be mindful of that, especially for your kids and grands. We have another question from Tony. My problem is waking up in the night, usually twice. I usually fall back to sleep, but it's disruptive. Any tips on how to sleep deeper, or why am I waking up?
So I, without knowing a little bit more, one of the triggers so it's natural to wake up during the night. We wake up multiple times during the night, and we usually don't remember it. But as we go through our sleep cycles, we go through periods of lighter sleep and deeper sleep. And when you're in a stage of lighter sleep, it's easy to be woken up, especially by noise. So if you think noise is contributing to this issue, one thing that I might suggest you try out, you can try earplugs, but if you're like me, you'll wake up in the middle of the night and recognize that you've thrown them halfway across the room because they were bothering you. So the other thing that you could try is white noise. And the term white noise just refers to kind of any background noise that's consistent. It's something that you'll just forget about. It's not meant to be listened to like music or things like that. So a lot of people use a fan, like an oscillating fan, just to have some background noise. And what that background noise does is it dampens or it reduces the ability of intermittent noise to wake you up. So I had, a while ago, I had a neighbor who let her dogs out at 6 a.m. And I already did some self-disclosure and told you I'm a night owl. I don't want to be up at 6 a.m. But the dogs would wake me up every morning, and I would think negative thoughts that would not allow me to get back to sleep, right? So what I did, a quick and easy thing to do, if you have a clock radio, turn that on and tune it in between stations. So it's just the static. And that for me was not annoying to me. It allowed me to go to sleep, but it also would drown out that intermittent barking that was happening every day. And that's how I solved my problem. Now, there are white noise apps. There are white noise YouTube stations. You can find white noise just about anywhere. But for me, that's been really revolutionary. For if you're in the hotel, I stayed at a hotel where I thought I could hear I could hear people breathing in the next room. That white noise is going to drown out those door slams at 4 a.m. as people go to the airport, and all that intermittent noise that is just so disruptive to sleep.
Thank you.
I think the other thing I would just comment on is I think that's really important. The other piece I would say is talk about the medications you're on with your medical provider, right? You might be on a medicine that makes you get up to go to the bathroom at night, and thinking about whether you move that to the morning so it's not disrupting your sleep. Thinking about some of the more activating medicines that we might be on, and whether we need to be thoughtful about when we're taking those medicines and how they might be keeping us up. Thinking about your caffeine use, and like I said, alcohol use as well. Those are all things that towards the end of the evening can really be disruptive in your sleep cycle as you think about them.
Dr. Edwards-Johnson, I need you to stop reading my mind, because that is exactly what I was going to mention and ask you about. The other thing that I thought was valuable is those tips that you mentioned, Dr. Tucker, would be helpful to people who do shift work, I think. Mm-hmm. So, if you're working at one of the plants, the car plants, or if you're a nurse or someone else working at Amazon warehouse, somewhere where you have shift work, that may be helpful. The other thing I wanted to bring up quick, and time is moving so quickly, it flies when you're having fun. One thing I wanted to bring up to you, Dr. Edwards-Johnson, as well, is can you talk a little bit about sleep apnea, which is when you stop breathing while you're asleep? Because I think that's one of the things that can also get you up in the night to go to the bathroom or wake you up. Or if you say you're having a dream or a nightmare and you wake up and you're gasping for air, was it really the nightmare or a dream, or were you just, did you stop breathing? If you could touch on that just briefly.
Absolutely. And sleep apnea is something we should always be thinking about, right? And we should be considering. It is something that increases the risk of mortality. It increases your risk of hypertension. And oftentimes, you will ask a partner questions like, am I someone who snores a lot? Do I seem like I'm maybe gasping for air? Am I someone who is, after a full night's sleep, I'm getting the 10 hours, but I wake up and I'm not well rested, right? You might go to the doctor or the dentist and they may say, your airway is really quite small, when I'm worried about your ability to move air. Those are all signs or things we should be considering as someone who might be at risk for sleep apnea. Certainly family history of sleep apnea would be important as well. And those are things we definitely want to be thinking about. So definitely having that conversation. Now, a diagnosis of sleep apnea requires you to have a sleep study. Increasingly, most sleep studies are done in a sleep center, right? Your primary care doctor, your healthcare provider will write you a referral to a sleep center. You will sleep overnight and they will monitor your sleep. They will monitor those sleep cycles that Dr. Tucker mentioned, how long you're in sleep cycles. And really what they're looking for is something called an apnea-hypopnea index. It's the main index that we use to sort of understand whether you are someone who has sleep apnea or not. And what that's looking at is how many times during your sleep cycle do you stop breathing, right? How often does that happen for you? And the more severe, the more at risk you are for future conditions down the line, and the higher your mortality risk is. Increasingly, we're seeing opportunities for sort of home sleep studies, right? You can sort of find them online. Someone will send you sort of devices to do those sleep studies at home. And thank you for putting the Stop Bang questionnaire. That is the screening questionnaire we use in the office, and it has some of those questions that I mentioned. The home sleep studies are a really nice option if you can't get in, especially during the pandemic. They were a nice option. The risk is that those sleep studies are, if they're positive, it tells you a lot. If they're negative, it's a little hard because we haven't done this really robust sleep study to know for sure with certainty that we've ruled out sleep apnea. So that's just one consideration that we should be thinking about with our providers as we get those sleep studies done.
Yeah, and I think that, talking about what kinds of symptoms you have with sleep apnea, but they can mimic so many other things. If you wake up with a headache, if you are sleepy during the day and you feel like you got enough sleep at night, those types of things can also be trigger. Or it was funny that you said that if you ask your partner, am I snoring? No, they're going to tell you. If you're really snoring, they're going to let you know. So, or if you're like me, when I'm getting a massage, I wake myself up snoring. So there's that. And keeping in mind that it's just because you snore doesn't mean you have sleep apnea, but it can be something that you should look for. Okay, couple questions. We have some men in the house. Good day, Mike. He says, I get to sleep easily, but wake up after 3 to 4 hours. I am beat the next day, but I cannot sleep. After several days of this, I get 7 hours sleep and I feel great, but it's only for one night. Thoughts?
My initial thought is that 7 hours of sleep is you've created enough sleep debt to just drive yourself to get some sleep finally. And that's what's happening. And I think this is one of those questions where, we need to investigate a little bit of why you're waking up after 3 to 4 hours. Is there noise in your environment? Are you on a medication that, is really leading you to wake up after that 3 to 4 hours? Are there things that we can do to sort of keep you sleeping through that next phase? But those are the questions I would want to get into. Is there something that's interrupting that fourth hour of sleep or that fifth hour of sleep? Are you getting up to use the bathroom? Are there medicines that you take during the day that are sort of activating you right after a couple of sleep cycles? Those are the things I would encourage you to have discussions about with your healthcare provider.
Here's a question for Dr. Tucker. It's a question from Dan. You described yourself as one who is more productive at night. How do you mix that with healthy body cycle in terms of sleeping at night?
So I am fairly fortunate that I can kind of set my own schedule, which allows me to, push my work day a little bit further in the day than many people are, fortunate to do. However, for those of you who are night owls, we can be productive members of society, right? We can get up and be at work by 7:30, 8 a.m. or whenever we need to be. with consistency. So we have to be very vigilant that we're getting to bed on time so that we can wake up on time, and make sure that we are able to hold down a job and not get fired because we slept in, right? So it's tough. Am I at my best at 8 a.m.? Absolutely not. But I can function and do things like that. So it's more of a challenge. The world was really created for you early birds, and I'm a little bitter about it. But we soldier on. We make do. So there is biology behind that, right? There's a strong genetic component to when you prefer to be active. It does kind of shift during the course of the lifespan. So we know adolescents are particularly known for their late hours and sleeping in. And as we get older, we tend to kind of come out of that a little bit, but we do have preferences of when we're most alert. And, I think that consistency piece is so important because it will help you to be aware and awake and alert when you need to be. But my preference, if you allow me to choose how I want to live my life, I'm not up at 8 a.m. necessarily. Well, actually, I kind of am, but I'm not doing stuff at 8 a.m. I'd rather be doing stuff at 8 p.m. than at 8 a.m.
Here's a great question from Sharon. Sharon asks, is napping not a good idea, or maybe just 10 to 15 minutes, like a power nap?
I love this question. Yeah. Go ahead, Dr.
No, go for it. 10 to 15 minutes. Yeah.
Primo. I completely agree. I think the idea behind napping is you just don't want to reduce your sleep debt so much that you struggle to fall asleep at night, right? There's a lot of good data that 10 to 15, no more than 40-minute nap can cause you to increase your productivity for the next couple of hours. So let's say you're feeling a little bit, you're dragging a little bit and you need to drive, right? That 10 to 15-minute nap can be a little bit restorative. It can really sort of get you that burst of energy that you might be looking for. The idea, again, is that you don't want to reduce your sleep debt so that when you really need to go to bed, you're not tired anymore. I was hoping to make a comment about melatonin. I don't know.
Yes, please do.
Okay. So melatonin can be, I think Dr. Tucker made a really good point about consistency, right? And having a regular sleep schedule, a regular sleep cycle can be very sleep promoting. People ask questions about melatonin. One of the main things I see in the office is that the doses like publicly available or over the counter are way higher than we actually need. They tend to be like 3 milligrams, 5 milligrams. The physiologic dose is about 0.5 milligrams. So you don't need a whole lot of melatonin. You need about 0.5. The other piece about melatonin is it works best if you take it at the same time, right? It's exactly what Dr. Tucker was saying about that consistency and sort of encouraging our ability to sleep and that sleep latency. We want to be really thoughtful about taking it at the same time every day so that we actually get the promoting behaviors. And all of these things tend to work better for people who don't have what we call chronic insomnia, right? Chronic insomnia is different from all of us who are just trying to do better with our sleep. And it requires a little bit more thought. But all of us who are doing a better job, we're getting 6 to 7 hours and we think we could be more restful and we think we can do a better job. These are fantastic strategies that we can think about.
We are running closely to our time to end, but I just wanted to quickly touch on a couple of more questions. I think these questions may be more involved and you may have to speak to your personal primary care provider, but one is from Carol, who asks, what causes narcolepsy? If we can touch on that just quickly and then just give her some questions to discuss with her primary care physician.
Yeah, sleep is one of these things where we don't say that there's a specific cause that we are aware of, right? There are several different conditions that either have genetic causes, have a neurologic focus, and I think this is an important discussion to think about whether is there a family history of narcolepsy in your family, right? Those are questions we should definitely be discussing with our healthcare providers.
And Dr. Edwards-Johnson, just for me, can you tell us a little bit about what narcolepsy actually is?
Yes, absolutely. So narcolepsy is a disorder in which people have often will fall asleep without a lot of warning. Some people will get a prodrome where they can kind of sense it coming on, but it's this pattern of sleeping during inappropriate times and is often sudden onset.
That's not like sleeping in church or synagogue or mosque. That's not that kind of sleep.
Or
Yes.
school, right?
I will say that it seems like you're more likely to have a narcoleptic episode if you're not well rested. So making sure that you have good sleep hygiene to promote that, and taking the medication that's prescribed will help.
Yeah, I think that goes for things like seizure disorders as well. If you're not sleeping well, they can bring on that type of aura, which is when you feel like it's coming on. Okay, quickly, there is another question from Peg. Peg asked for suggestions for sleep apnea and claustrophobia because Peg is finding that the CPAP is not helping. Any offers?
This is a really great question. Oftentimes this is a collaboration between your sleep specialist and maybe even your dentist. There are lots of different appliances and different things that we can consider for sleep apnea treatment. CPAP, as you mentioned, is often first line, right? It is the go-to gold standard device for sleep apnea. But as Peg has alluded to, it might not work for you. There have been a lot of advances in sleep devices. They've even changed CPAP machines. So some of them aren't necessarily that big mass. They've fitted them differently. There's lots of things that manufacturers are doing to make this better. But I would say the next step is often a consult or conversation with your dentist about appliances that you might use, different ideas about how you can control your sleep apnea if you have claustrophobia as well.
Excellent. We're going to take one last question. Then I want each of our guest speakers to give us just the take-home message from today that they would like people to remember. And if there are other questions, this is supposed to be a conversation to encourage you to investigate more. Talk to your primary care provider, because we're not giving you the medical advice that you need because we're not tailored specifically to you. But good, this is good that the conversation has started. So one last question from Rhonda. Rhonda says, I just started napping out of nowhere. Should I be worried?
Without knowing the details, I want to know how long you're napping. What has your nocturnal sleep changed? Are you experiencing any illness? Are you recovering from something? I have lots of questions for Rhonda. But again, if you feel like this is weird, this is not right for me, go have that conversation with your primary care physician and get it checked out, because like I've tried to hopefully get it, communicate to you. Sleep touches all aspects of our lives, right? All of those chronic diseases, all of the infectious disease, the mental health, memory, emotional control, like all of these things are affected by sleep. So if your sleep is changing, there's probably a reason for it. It may be medical, it may be environmental, it may be behavioral, but without kind of doing the work to kind of dig through that, we won't know.
I will say that one of the principles of osteopathic medicine is that the body structure and function are interrelated. So it could be something that doesn't seem like it's related to sleep at all, but it's causing you anxiety. It's keeping you from resting, which can, cascade into a rolling ball down the hill, which is not a good thing. So if you really feel concerned about your health, I hope that you will take this time to when we finish this conversation, call and try to make an appointment. Well, it's probably still lunch hour, but when they get back, just send a message or give a call and just try to get in for an appointment to chat a little bit more about these things. Okay, wrapping up. Dr. Edwards-Johnson, give me a bullet point that you want our audience to remember.
I think on the heels of this question, I think listening to your body. If you are feeling rested after your sleep, take that as a win and make sure you're communicating that with your healthcare provider. If you're not feeling rested, get curious about why that might be and make sure you're having that conversation with your healthcare provider as well. And consistency. I think that was really important, right? Let's have a consistent sleep schedule and consistent sleep plan daily. So thank you so much.
What about Dr. Tucker?
I'm going to be consistent in my consistency messaging, and bang that drum one more time. And again, we're not robots, right? Like you will not be perfectly consistent in your sleep schedule. You'll want to stay up late and, be social or do something fun. But the consistent part is, okay, wake time is wake time. Don't move that around because you had a late night. It will help you to get to sleep the following night. So do the best you can. If you have more days where you're consistent than you won't, I think you will see an improvement in sleep outcomes.
I tell you, I miss the days of college and med school where you could just be up all night and get up and feel fresh the next day. Those are long gone for me. But I want to take this opportunity to thank you all so much for being here. I'm so excited about this conversation. I hope that you've gotten something out of it as well as an audience. Thanks again to AARP Michigan and to President Paula Cunningham. I know her personally, so it is almost like she's a doctor. So there's that. And I also want to encourage you to register for our next event in the series, which is called Pain Points, Easing the Ache. And that's going to be next Tuesday, June 13th at noon. Remembering that all of these series are on Tuesday and they are at noon. So the next one about Ease the Ache is practical strategies to joint pain and improving your joint health. On the 20th of June, what you need to know about gut health, gastrointestinal issues, strategies for a healthier gut. And I think that some of us have noticed some changes in our gut health as we've gotten older. So the last one will be on June 27th, and that's called Gotta Go Right Now, talking about causes, symptoms, and treatment of urinary incontinence. And all of these are, of course, for males and females and all ages, because there are other things that can cause it. Of course, I know a little bit more about the pregnancy part, but I digress. Thank you once again, everyone, for joining us, and we welcome you to come back. And I hope that you have a healthy day and a healthy week. Take good care.